It starts with a fever before progressing to vomiting, organ failure, and internal and external bleeding. Governments in West Africa are battling to contain the worst ever outbreak of the deadly Ebola virus, which has claimed the lives of nearly 700 people in Liberia, Guinea, and Sierra Leone since February. Unlike the last epidemics, which were confined to remote villages in Central Africa, this time the outbreak has reached major urban centers and even capital cities. Now, doctors and officials fear that the disease will spread through West Africa.
We understand that in this part of the world, the borders are very, very porous, so it's quite easy for people to cross from one country into another without detection, without using regular border crossings.
Last week, a Liberian civil servant died in Lagos, a Nigerian megacity of more than 20 million people. His death marks the first recorded case in Nigeria, Africa's biggest economy and most populous country. Nigerian authorities have closed and quarantined the hospital where he died.
This is a firm confirmation that we had the virus brought to us. And only God knows how far the thing has transmitted.
Ebola is passed on by a combination of physical contact and bodily fluids. It kills its victims in around 60% of cases, but it's less contagious than other germs such as influenza and tuberculosis. Medical charities say cultural skepticism of doctors in parts of West Africa and a lack of health infrastructure have made controlling the outbreak a major challenge. In Sierra Leone, the government has deployed police at least 2 clinics to protect doctors from relatives of the sick. The family of a 32-year-old woman who tested positive for Ebola in the capital, Freetown, stormed an isolation clinic and took her away before she died at the home of a traditional healer.
We had information that this patient was taken to a traditional herbalist for treatment. We followed the leads. We are still not able to get hold of the patient. But the process, as I said, is ongoing. It's in the hands of authorities, including the law enforcement, the police, and other relevant authorities.
Traditional funerals are another source of concern because relatives wash the bodies of the dead and in many cases pick up the infection. After months of indecision, West African countries have now increased their efforts to contain the virus, for the first time imposing travel restrictions. US officials say the virus is not likely to spread beyond Africa, but with the death toll mounting, officials around the world are now paying close attention to the crisis. Javier Blas, Financial Times, London.